Jones. My name is Meranda Morgan. I'm going to be your student nurse today. I've just been asked to give you some education on your disease today. Is that okay? Okay, I'm just going to sit down. So we're just going to start by talking about what caused your disease and the course of your disease in your body. So chronic kidney disease is typically caused by diabetes or high blood pressure. High blood pressure can cause chronic kidney disease because it damages the arteries in your kidneys, and once the arteries are damaged, they cannot get enough oxygen to your kidneys, and kidneys need oxygen to function properly, and their job is to filter your blood. So without the oxygen to do their job, they cannot filter your blood, and this ends up causing fluid retention and sodium retention because salt stays with water. And this also causes potassium retention, and it actually causes the sodium in your body to become decreased because you're retaining so much fluid that the ratio just isn't correct, so your body doesn't have enough sodium, and it just causes a lot of waste products to be accumulated in your blood, and they can't be released because the kidneys aren't functioning right. So, and that fluid retention also damages the heart because extra fluid in your body is extra workload for your heart because it's pumping all that extra fluid around. So we diagnose chronic kidney disease with some lab tests. We do a blood and a urine creatinine test. Creatinine is a waste product that is excreted by the kidneys, so if it's increased, this is a good indication that the kidneys are not functioning properly. We also do the GFF, glomerular filtration rate. This is how much blood is going into the tiny unit in your kidneys. And if this is decreased, it means that the kidneys are not getting enough perfusion, which just means they're not getting blood to be filtered. And we also test for protein, a protein called albumin in the urine. We don't want to see any albumin. So some modifiable risk factors for chronic kidney disease. Smoking is a huge factor that can contribute to high blood pressure and chronic kidney disease. It's important to stop smoking whenever you can. It's never too late to stop. The longer you continue, the more at risk you are. Another modifiable risk factor is alcohol. Alcohol can contribute to high blood pressure and damage the kidneys as well, so we want to stay away from alcohol. And diet is a huge modifiable risk factor. There are many different things like with electrolytes and salts and things like that can contribute to kidney disease. And exercise is a modifiable risk factor that, when done properly, can reduce your risk for chronic kidney disease. So to treat your condition, we're going to restrict your fluid intake. This will prevent fluid overload and your heart from having to work extra. We're also going to get you on some blood pressure medication to lower your blood pressure. And some diuretic. This is just something to help you pee, help your kidneys work properly, and get some of that fluid out. It also helps relieve any swelling that you have. We're going to get you started on a low protein diet, and we're going to give medication to help with your anemia. Your red blood cell count is very low. So we're just going to get you some medication called EPO, which is a hormone that your kidneys would normally be producing, but are not because of the kidney disease. We also want to get you on some calcium supplements, and restrict potassium because you're retaining that. So more specifically, the diet modifications we're going to be making, limiting fluids, making sure to not drink caffeine. We also want a low protein diet, so some examples of this would just be vegetable, cereal, corn, or not corn, bread, pasta, and rice. We also want to limit your salt intake, so we don't want to be going to any fast food restaurants, no processed foods. Try to eat foods that don't have any added sodium in them. We also want to limit potassium, so green leafy vegetables. And we want to get good fat, so this includes things like olive oil, peanut oil, and corn oil. And even though we are doing a low protein diet, we still want to make sure we're getting enough calories to maintain a healthy weight. We want to get complex carbs like pasta and brown rice. Yeah, do you have any questions? Okay, thank you.